Welcome to PlasticSurgeryTalk.com. My name is Dr. Stephen Mulholland, your host. Unwanted fat, wiggly jiggly areas that detract from the contour, shape, and form we desire. Very, very common. Not many people, however, want to undergo liposuction. There's some risk and there's recovery. There's some discomfort. Even with the new techniques like smart lipo and body tight and vaser lipo, there's still a surgical procedure that needs to be done. Fortunately, there are lots of technologies now available where you can shed a couple centimeters here, a few centimeters there. All kinds of technologies, ways that we can melt fat without surgery through non-surgical body contouring. Let's take a look at one patient's non-surgical body contouring journey.
They are having lots of fun with the makeovers today, let me tell you. And we're actually having quite a bit of fun with Dr. Steve Mulholland, which is here. He's here with us from SpaMedica. I gave them a little sneak peek in the audience. I said we're going to be talking about this procedure. Very new, very cool, not very invasive, right?
Not invasive at all.
Not
Absolutely.
invasive at all.
Yeah.
So are you paying attention? Okay, they've got their notebooks and their pens ready. Let's take a look at a procedure called Zerona. We're going to learn about it right now.
So summer is looming, and this is a great start to the summer.
Yes, I know. I'm excited.
How was the program? Any problems, difficulties, or concerns?
No, it was very easy. I do a lot of aqua fitness. I work out about maybe 3-4 days a week, but it's not helping. I think I need something extra to just help me get the shape that I want.
We're heading into summer. Everybody's thinking, I got to squish into or wedge myself into my new slacks or my old slacks or my new bathing suit. That's where Zerona fits in. It's an opportunity to work with your diet and reasonable lifestyle choices to slim in a bunch of areas that bug you for the summer. This is what we call a low-level, high-fluence laser. It's a cold laser. It stands away from your body. It sends beams of laser light through the skin into the fat. It doesn't touch the skin, injure the skin, or interact with the skin at all. So in 40 minutes, it takes 40 minutes, those little laser beams go in and affect fat cell metabolism. And simplified terms, it opens a temporary pore in the membrane and leaks out the contents, sort of like popping the balloon, out comes the air.
I lost up to 6.5 inches all over my body. So it was a great experience for me. My clothes, it fit better. My jacket is actually loose, as you can see, and my skirts to fit better. Overall, my clothes fits really nice. My body's actually changing shape, so I'm more curvaceous, more nice in the right places. So I just love it. It was a great experience.
So here's what gets people excited. When you say to them you can lose between, what is it, 3 and 6 or 3 and 9 inches?
We actually guarantee between 3 and 9 inches of generalized slimming.
Unbelievable. When I tell people this and you tell people this, there is all sorts of excitement because we're not talking about going on a diet for 6 months. We're talking about basically going under some lasers and spot reducing. Like, why is Zerona so special? How does it work?
It's very cool because we have a lot of technologies that will focus on an area.
Yeah.
Let's say I really don't like my pot, or
Yes.
I don't like my hips.
Yeah.
We have things that will melt a couple of centimeters over 3 months on that. This is the first laser where there's no heat, no pain, no downtime.
Hold on, no pain?
No pain. No pain.
Okay, I lied. Okay, it doesn't hurt. It doesn't hurt at all.
No pain, not no paying.
Yes,
no
you have to
pain, no pain, no pain. Yes.
You need
Yes.
your wallet,
Yeah.
but
it's actually
won't
a very
hurt you.
affordable solution when you compare it to Weight Watchers or Herbal Magic
Yes.
or Dr. Bernstein. This is a way that in 2 weeks you lie on your front for 20 minutes on your back 6 times.
Yeah.
And the machine works consistently enough, we guarantee between 3 and 9 inches, whereas others are focal spot reducers.
Yes.
Between your bust line and your knees, you'll have 3 to 9 inches less fat that you can then, wear your summer clothes or dresses or skirts or bathing wear more comfortably.
So, okay, Okay, so Steve, let me get this right. There's absolutely no pain. What does it feel like then when those lasers are running across your body?
Well, as you can see, there were rotating beams of these lasers, and they're a specific wavelength that penetrates through your skin. Normally when you do that, photofacial, hair removal, other fat melters, there's warmth and discomfort. These are cold laser beams. They go through your skin. They penetrate about 2 centimeters into the fat cell, which you can sort of imagine they're a swollen balloon hanging onto all those deep-fried foods and those, you know, those calories that we take in. And it's like a little needle that pops that balloon, lets some of the contents out, triglycerides, which contain those empty carbohydrates. Our body metabolizes it with lymph system and digestive system, and over 6 treatments, millions of cells have basically gone from a balloon to a raisin, which reflects in how slim you are.
But that also tells me, though, that you can't go and eat a whole big bag of potato chips after this, because those raisins are going to turn back into balloons if you fill them back up again.
So, exactly. The balloon isn't destroyed, so it's just common sense. It's like any diet. If you say, oh, I just went on this diet, and now, okay, I'm ready for that double pizza and a liter of
That's
Coke.
what I would do.
Yeah, it's common sense, just weight maintenance. Weight maintenance, and this is a long-term opportunity for those that have diet and exercise, and they've got an event. In a short period of time, in 2 weeks, you can feel a little better in your clothes.
How many times do you have to go?
It's 6 visits over 2 weeks.
Yeah.
And then the average patient will do it once a year, perhaps a little, you know, little discretion after Christmas, or maybe after a trip or a holiday where you may have taken more calories than you burnt off. Good way to slim down quickly, where diet and exercise has left off.
Okay, well, let's take a look. We've got some pictures here of a couple of examples. We did see one in the tape, but this is a before and after. And visibly, so she's lost there in her tummy. Do you put it only in a specific area on her body?
Yeah, so most women do not want to melt fat off their top. So we start from below the breast down to the knee. And this lady is, she's one of our 9 or 10 inch reduction. We have patients that over 2 sessions have lost up to 17 inches.
17 inches. That is really, really, that's a lot.
Now what's neat about this is the guarantee. If you don't get at least 3 inches, you get a complimentary series of treatments, no charge, following that. And there's never been a technology where we've been able to offer that kind of confidence.
Very nice. Okay, let's take a look at another shot here. Another before and after.
Again, if you look at that, that would be very
visible.
comparable to what you would achieve with liposuction. Not everybody gets 10, 11, or 12 inches, but 3 inches you can feel in your clothes. It feels that you're maybe not down a size, but the size you're wearing feels looser. At 6 or 7 inches, you're down a size.
Okay, my floor director wants to know where you get those panties from.
They're very attractive, yes, yes. It comes with your medical degree.
You always have the special panties.
I've got some in my back pocket if you want.
Maybe I'll try some out a little bit later. Does it work everywhere in your body? Is that just for, tummy, thighs?
It's for truncal problems. So, you know, if you have a little focal area of fat here, we've got some other options. If your arms are the focused area that bother you, we've got options for that. And again, we keep below the bust line and above the knee. So everything in that nether region that pugs you in your clothes, in your bathing wear, in your skirts, in the summertime type of clothing, that's a good, those are areas where you're a candidate for.
I'm imagining if there's no pain, then there's no recovery time.
There's no recovery.
So you just jump off the table and go to work.
Bring your iPod, lie on the table, 20 minutes at the front, 20 minutes on the back. And that's the only time I think in 15 years of being on the show I can say, ain't no pain.
Unbelievable. You're a good little salesman, because everyone's going now after the show. That's a very, very awesome procedure. And I might say, you know, I like your hair cut like that.
Well, thank you. Yes,
I'm looking at the tape, and between the tape and you live now, I like the hair shorter.
Well, it's actually Zerona does your hair too. No, I'm just sorry. I did cut it because it was looking unacceptable in that tape.
I liked it. I like it. I like it.
Welcome back to the studio. Dr. Stephen Mulholland for PlasticSurgeryTalk.com on non-surgical body contouring. Can you believe that story? 2, 3, 4, 6 centimeter changes on a lot of these technologies, on frustrating areas that you've tried your best in the gym with diet and exercise. If you are frustrated and you've tried everything and you're not yet ready for a liposuction type, smart lipo, body tight, or vaso lipo procedure, check out our physician finder section here on the website, PlasticSurgeryTalk.com. Find a physician near you that specializes in the art of non-surgical body contouring. Get ready for summer, get ready for looking slim in that suit or that dress through non-surgical body contouring. Thank you very much for watching PlasticSurgeryTalk.com. I'm Dr. Stephen Mulholland. We'll see you soon.